Number 10. Theranos that works. Disgraced biotechnology entrepreneur Elizabeth Holmes ran Theranos, a Silicon Valley company that claimed to have created a machine that would revolutionize blood testing. A simple drop of blood was needed to run the Theranos test, which could detect diseases like diabetes or cancer. The company boasted that they'd be more efficient than a 10 to 15 millimeter vial drawn at a lab, but Theranos was nothing more than smoke and mirrors. The technology didn't even exist, and Holmes was sent to prison after defrauding investors for an astronomical sum of money. But now, Stanford University researchers are making progress in a study to develop what they call Theranos that works. Ironically, it was Stanford where Holmes was a student and dropped out to run Theranos. This project is in the preliminary stages, but a researcher working on the project told the press that they can follow one's metabolic markers, immune markers, and even some neurological markers that may give insights into that person's mental health. So if this machine really works, a far simpler blood test could give doctors insight on diagnosing patients with only a few drops of blood. Number 9. 3D printing surgery. 3D printing is sometimes used in surgeries, but it's about to take a bigger step. Did you know prototypes and patents similar to 3D printing date back to the 1970s? Currently, places like the Mayo Clinic and some VA hospitals in the United States have 3D printing labs, which are used for staff training, medical models, and procedure simulation. And over the years, there have been some impressive advancements. In 2021, a hospital in Sweden was successful in creating a 3D printed skull implant for a patient that suffered a massive head injury. However, the full potential of 3D printing in surgery has yet to be realized. In 2018, healthcare represented 10% of the 3D printing demand. The 3D printing industry could be a $60 billion industry in 2030, and hospitals could reap the benefits. Some tools can be patient-specific, and models can be created to cut down on surgical time. 3D printed organs are somewhere on the horizon, but it could be here sooner than later. Number 8. Brain-computer interface. Does linking your brain to a computer sound cool or frightening? Brain-computer interface, or BCI, is here, and it's used to link a brain with a computer or another device. BCI allows scientists and doctors the ability to work with patients with motor impairment, which is when one of your body parts experiences a partial or total loss. BCI has the ability to be used in fields like rehabilitation, robotics, gaming, and neuroscience. But there's also hope that BCI can be incredibly useful in working with patients that have suffered a stroke, are struggling with mental illness, or dealing with a complicated disease like Parkinson's. And the future of BCI may involve improving the focus and drive of workers. Some companies want to develop devices where they can monitor dangers in the workplace like drowsy driving. There's a super creepy side to BCI as well. The technology could be used to track your awareness at a staff meeting, or it could be used at a business convention to see which booths are of interest to you. This is a bit frightening as it's absolutely intrusive. Also, your password could end up being a simple word you bring up in your head instead of typing it on a computer or smartphone. It's hard to tell how far away that technology is to becoming a reality though, so for now, you can resume pretending to be interested during your next Zoom meeting. Number 7. Nuclear fusion. There's a divide right now on the type of energies we're using or should be using. Coal and natural gas have been the standard, while others debate the environmentally friendly benefits of solar power and wind power. Nuclear power has entered the discussion, but thoughts of another 3 Mile Island and Chernobyl leave many worried about a nuclear meltdown disaster. Scientists are looking to develop a cheap and safe alternative using a process called fusion. But what is fusion? Basically, it's a method where scientists and researchers replicate the way the sun and stars are powered. An energy-producing nuclear reaction is the power source for the sun and the stars. But the downside is that the reaction produces way too much energy. If we can develop a nuclear fusion reaction that produces a small amount of energy in a clean and safe manner, then we'll achieve something huge in creating clean energy with zero carbon emissions. This project is in a very early stage, but a laboratory in California did achieve something known as ignition, where the small amount of energy put into the reaction produced a larger amount of energy. Nuclear power plants today rely on nuclear fission, which means their manner of producing energy results in radioactive waste. And this is another environmental issue when it comes to storage or disposal. Fusion would significantly reduce the radioactive waste. And while fusion is a technology that will have a major impact on the future, it continues to be an incredibly difficult project for scientists. As Omar Hurricane, the chief scientist at Lawrence Livermore National Laboratory, said, "We're basically making stars on Earth." Number 6. Gene editing. Gene editing or genome editing isn't something that could happen, it's already happening. As a matter of fact, genetic engineering can trace its roots back to 1970. Scientists have the ability to edit DNA, and at the time of this video, there are no known regulations in place for this practice. In 2018, a scientist in China claimed that they edited the DNA of 2 twin embryos during fertility treatments. Their plan was to make the daughter's genes resistant to HIV. But what was the reason for this? The father was reportedly HIV positive, and the scientist hoped their work would make it more difficult for the twins to contract the virus. This research was criticized as barbaric, but was praised by others. Some wondered if the gene engineering stays with the subject or can be passed from generation to generation. This is a highly controversial subject because it's tied to eugenics. If this science can move forward, then there's a chance that we can eradicate genetic diseases like sickle cell disease or even cystic fibrosis. There may even be a way to prevent blindness and children being born deaf. But could this science be used to create designer human beings? People with perfect features or a certain size? Could it also be used to end certain forms of mental illness or neurological disorders? In truth, the possibilities of this type of science could lead to is monumental. Do you think it's possible that in the next 50 years, it will be more common to have designer babies born in a lab than babies that are born naturally? Let us know what you think in the comments. And while you're at it, subscribe. Number 5. Extended reality. Imagine taking virtual reality and mixing it with other technologies like mixed reality and augmented reality. Then, add some emerging technologies to the mix, and what you get is extended reality or XR. Imagine being in a meeting in Los Angeles, and you go directly to your client's office in London for a meeting using XR so you don't have to leave the office. Data and graphics that were only once visible on a tablet or phone are now easily viewed in the XR world by yourself and your client. Imagine going to see the pyramids in Egypt or the Great Wall of China without leaving your house. Think about it. No more airport lines or waiting forever to get through security or losing your luggage on a flight. You could even walk around major cities and explore national parks and interact with other tourists from around the world. Your favorite artist could tour using XR, and you could easily just pop in and check out the show. It'll be easy to tour homes you want to purchase, and your place of business can use XR technology to train you for new policies or a new device at work, right from the comfort of your home. While all of this sounds amazing, XR isn't cheap, and it's also a technology that can be vulnerable to cyber attacks. But it's a changing technology, and it's possible that we could see some interesting advancements in XR over the next 5 years. Number 4. Xenotransplantation. Xenotransplantation is an experimental treatment that's currently only allowed in extreme cases. But the technology to perform this treatment has been around since 1906. In a nutshell, xenotransplantation is taking non-human cells, tissues, and organs and placing them in a human patient. While this has been attempted in the past, it's been anything but perfect. Changes in technology will advance this practice to a more safe and reliable form of medical care. There are people waiting for organ donors that they really don't have the time to wait. Scientists have been able to transfer the kidneys, heart, or liver of one animal to another, and one animal that might provide this assistance for humans is the pig. Cells and tissues from animals like pigs have the ability to help patients with Parkinson's disease or type 1 diabetes. Tissue or skin from a pig could also be used with burn patients. But why pigs? It's because they're readily available animals, and their organs are about the same size as a human. There's also a low risk of disease due to organ transfer. But of course, this practice isn't without controversy. Animal welfare and even religious beliefs must be taken into consideration before xenotransplantation can be performed. Also, the pig isn't the only animal that's being used for xenotransplantation. Surgeries in the 1960s and 1980s attempted to use primate organs on human patients. So what does the future hold? More tests must be completed and approval is required, but if science can make this a safe and effective form of surgery, then expect to hear more about it in the future. Number 3. Necrobiotics. If you think this technology sounds like a title of a cheesy horror movie or the name of a death metal band, then you're not alone. Necrobiotics is a technology where the dead could be brought back to life in a way. In 2022, it was reported that researchers at Rice University in Houston, Texas, were able to take dead spiders and repurpose them as tiny grippers. All this took was a syringe, a needle, some glue, and giving it the old college try. But what could these tiny little spider grippers do that's useful? These spiders could be used for gripping tiny electronic components. Spiders have the ability to grasp objects that are 130% of their own mass. Spiders work differently than mammals. They have a hydraulic system of sorts for their grippers. And the researchers at Rice University said that while they have the gripping down, they'll need to find a way to make the spiders crawl. While this is technology in its infancy, could there be a future for necrobiotics? It's uncertain at the moment. However, tests could be performed on other insects or mammals for various studies. Although this isn't bringing the dead back to life in the traditional sense, it may be a study that proves to be beneficial. Number 2. AI. You may have heard a thing or two about AI. So what is it, and why is everyone freaking out about it? Simply put, AI, or artificial intelligence, is where a machine has the ability to perform a task that requires human intelligence. The story of AI goes back to the 1950s, and it's definitely blossomed since then. ChatGPT is an AI program that can provide a response based on the context and intent of a question posed by a user. AI is even producing artwork, and it has the ability to perform other tasks which may result in AI taking over certain jobs in the workplace. If something like ChatGPT can understand text as well as read and write, then AI could replace journalists or technical writers in the future. Paralegals and stenographers could be replaced in the legal profession. Also, expect to have AI introduced into the world of teaching. Your child or grandchild's teacher could be an AI program or machine. And in addition, you could have a medical screening or doctor's office visit with something that's AI. While this may be fascinating, it's a bit frightening for some. Replacing humans with robots is overwhelming. But AI should be used to benefit humanity, not to exploit it. And at number 1, quantum internet. We bank online. We do our taxes online, and we apply for mortgages online. And with all of this personal information online, we're definitely targets for identity theft. Imagine a situation where it's much easier for this to happen. Not only would our very own private data be vulnerable, but so too would be highly classified documents and sensitive data that countries don't want getting out. The quantum internet would use quantum physics, and it'll basically change the internet game. The University of Chicago explains the quantum internet as a network of quantum computers that will someday send, compute, and receive information encoded in quantum states. And while this sounds like a Sheldon Cooper type of project, it's something very impressive and frightening. Quantum computers and quantum internet could make cyber attacks more effective against the best supercomputers. The New York Times summed it up best when they said, "The technology will perform tasks in minutes that even supercomputers couldn't complete in thousands of years." Those who possess this technology will definitely have an upper hand, so it will be imperative that banks, companies, and countries get into the quantum internet game before it's too late. You can breathe easy for now, as this technology is in development and isn't perfect yet. Also, it's believed that the quantum internet may not replace the internet we use today. But keep an eye out for this topic, as it will definitely be one of those technologies of the future that will absolutely revolutionize everything. Which topic did you find the most interesting? And is there anything you think we left off the list? Let us know what you think in the comments down below. And if you enjoyed this video, be sure to leave a like and subscribe to the channel. Thank you so much for watching, and we'll see you in the next one. Bye for now.